started here with our safe return to school town hall meeting. I know it's been a long day for everyone. Let's see, Dr. McFarland. We are in week 2 of virtual learning. This is we've 2-week anniversary today, September 22nd. So everyone's doing a phenomenal job, getting lots of positive feedback from our community. And this opportunity to just have our elementary teachers together, talk about where we are and what's ahead the next couple of days and weeks.
Just right out in the front.
Yeah, we're definitely excited to talk with you all, and we know you all have questions, and so we want to try to give you as much information as we have at this point in time, and then just entertain questions from you all that you may have, so that we can all move forward together with the same amount of information. But just to echo what Kirshner said, I recognize that you all are doing some awesome work in some not so ideal circumstances, and I appreciate the extra time and energy it takes in order to stand up virtual learning. So thank you all for that, for sure.
Absolutely. Well, it looks like we're up to 80 attendees, and we have some panelists on here from central office, and we also have several board members just logging in to listen in to hear what teachers are questions are being asked, and to just share their support. Miss Hall, our board president, isn't able to talk right now, but she just sent us a message. She just wanted to thank all of our teachers on behalf of the board. Looks like we see board member Miss Davis, Dr. Tanya Woodson-Mayfield is one of our attendee, Miss Benton. Our board has been incredibly supportive every step of the way throughout this pandemic, putting student and staff needs first and always focusing on safety and security. So to our trustees, we say thank you. Thank you for your support. Thank you for listening. And thank you for making the hard decisions for our students and staff and entire community. Dr. McFarland, you want to start with some Tarrant County updates?
Yeah, so what I want to do is, again, thank you to our board, because our board is always available. We have, over the last 3 months, had a series of calls to review the data, to review the science relative to opening school and relative to the pandemic. And we remain committed to doing that. And so I would like to start with just sharing with you all the Tarrant County dashboard and just talk to you about the kind of information we're using to make decisions about our plans moving forward. So Kirsten, if you could pull that dashboard up, then I'd like to just kind of walk them through this piece. And please feel free to, if you have any questions, to drop them in the chat, and we will attempt to respond to those questions if we can.
So Dr. McFarland, what you see here on your screen right now is from the Tarrant County website. Anyone can log in and see this. This is a public site. And right now what it's listed on is all of Tarrant County. Okay. But I'll just kind of follow your lead if you want to zoom into our specific attendance zones and kind of talk through what's on here.
Sure. So what I normally do, I would go in and put in Crowley. So we just put in Crowley ISD, and of course it's by our 2 high school attendance zones. And so we always look at our area. And the good thing, well, not the good thing, the reality about this dashboard is that we not only can see Crowley and Crowley ISD, but we can also see others. But we focus first and foremost on Crowley ISD. And so we'll just look at the Crowley ISD boundary with both high schools. And then if you go over to the right-hand side, my right-hand side, over under the recommended learning scenarios, of course, Tarrant County, they only make recommendations, and then we have to take the information and have a conversation. And so what normally happens, or what has happened in the past, is that I would pull this up and have conversations with board members and also with the team at the central office, and we would evaluate the key benchmarks that Tarrant County has identified. As we're looking at the benchmarks, we're looking to see the case rate. We're also looking at the second one is a 4-week case trend. And then we also look at the like illnesses and to see whether that's going up or going down. Hospital beds, as you can see. And then a key one really is, I believe the 5th one is positivity rates. And so all of these 5 benchmarks taken kind of together, we use that information to make decisions about, or have used that information in the past to make decisions about whether we start or not. We also look at our neighboring areas. So we look at Everman, we look at Burleson, we look at Fort Worth, And then we look at, I believe it's South Hills High School and maybe Southwest is another one. But these are high schools that border our zone. And we look at those just to kind of see what's happening in those areas as well, because we know that that we have families that move around, and we know if it's if it's red in one area, even if we're yellow, it's likely to be red in our area in a short period of time. And so this dashboard is updated every week. And so what we do know is that there may be a situation and a circumstance that's present on Sunday that by the time we get to work on Monday or even Tuesday, then it changes completely. And so when that happens, then our decisions, we have to build ourselves time and opportunity for our decisions to change as well. I can tell you, and you don't have to go through all of it, Kirsten, at this point, but you all can have access to this. This is on Tarrant County website, and it's our school reopening dashboard. But again, we look at that right now. Both high school zones are red, and interestingly, on Sunday, I normally send message to board, and on Sunday, as I was putting the message together, I looked at the dashboard again, and the positivity rate was about 8.7. It was pretty low, and so anything below 10 is considered going in the right direction. If it's going down, if it's above 10, there's reason for concern. But it was pretty low. So on Sunday, I sent a message out saying, hey, we feel pretty strong about our October 5th start date. Well, by the time we were done with the workday on Monday, this dashboard changed. And so it was as you see it right now. And that's 11.2%. And we see that the 2-week trend for positivity is actually increasing. And so we monitor this because we recognize that we have some decisions to make. We are currently scheduled to return to face-to-face on October 5th. And quite frankly, it will be for lack of a better explanation, it will be a game time decision for us. And that simply means that we're going to be reviewing this data in conversation and in consultation with Tarrant County Health Department. We'll be reviewing this data, looking around, observing what's happening in other places, and be making decisions based on the most recent data. So what I can tell you is that next Monday, this benchmark, this dashboard will be updated based on September 28th data, and it is likely that it will even be October 1st, which is the Thursday before October 5th, that before we can make a clear and semi-final decision. But again, I want you to know right now we are preparing and prepping for returning to school on October 5th. I also realize that Fort Worth ISD is reconsidering their decisions tonight at the board meeting. Not sure which way it will go. Want you to know that we are paying attention, but we're using the science and the data to guide our decision, and we definitely will prioritize safety over everything else. The other thing that we do recognize, though, is we know that there are some students that absolutely need to be back in school because they may not have the privilege of having a safe, quiet place to work. And so we are in the process of identifying satellite learning centers. We have 3 of our churches, 4 of our apartment complexes that are on board and willing to help us to create additional spaces on either in their apartment complex or in the churches for students who choose to be virtual and to be able to go there. So that's if we do decide to come in and delay, we also will have a plan to meet the needs of those kids who just may not be in an ideal situation at home. So that's kind of what as it relates to making a decision, we use the dashboard, we have conversation with our health officials, and we also observe what other districts are doing. But in addition to that, we are focused at the district level on having a safe start. And so we have a team that's called Project Safe Start. And so with this team, we've created a pandemic response team on every campus. And currently we're doing walkthroughs on every campus. These walkthroughs are critical because we are, sitting in our offices, and planning is just a little different than actually walking through the building. And we know, and so we're able to walk through the building now. We are going around, and we'll be on every campus, and we're just looking at the space in the classroom, and we're seeing if it's feasible for us to be able to social distance, and where it's not, we're making note of that. And so working through kind of procedures for be well rooms and all that. And so I want you to know that we are walking through this process and trying to be thoughtful, prioritizing safety for sure. The other thing is on Monday, we actually had, many of you know, actually at the beginning of the pandemic, we made a connection with an educator from China. And so we had received direct information from her because she's over English department there at a school near Wuhan, China. And so we actually learned a lot about what they were doing to combat the virus and mitigate the spread because they returned to work. And they're about 3 months ahead of us. And so we have been kind of keeping in contact with her, sharing our plans, listening to their plans, and kind of modifying our plans to make sure we're addressing any unknowns. And so we had her talking to us again on Monday. And so on Monday, she shared that they are now back to normal with no mask, and it took compliance. It took 100% compliance, but they are back to school, and everything is back normal without mask, without social distancing now. So it was good to see that because it let me know that there is hope. It may be 3 months away, but there is hope that we can get things back to normal, soon. Again, I know virtual learning has been hard. It's been tough for a lot of you, and I appreciate you being flexible and agile. And we're here today really to kind of take questions about face-to-face and any other questions that you may have as a group or individually.
Dr. McFarland, we had a lot of teachers email in some questions, and we have some of those ready, but as you're here as an attendee, please utilize that Q&A box, ask us some questions. We have some different district administrators here to help answer as many as we can. Dr. McFarland, another thing that's going on this week that runs through tomorrow is our change window for families to decide if they want to come back October 5th or if they want to stay virtual longer. And we're getting a lot of responses to that. Mr. Keith and our PEIMS department is communicating with principals, letting folks know who's selecting to come back in person. One of the questions kind of related to that is, I guess Ms. Lyons was one of the teachers that asked this over at Davis Elementary. How many students will we allow into our classroom for face-to-face learning before it's considered unsafe? And I know a lot of that will depend on how many students select in-person learning.
Right. So, right, that is correct. And so, our staffing guidelines, we're still holding true to those staffing guidelines. However, in situations where there are modifications that are needed, we'll be willing to make those and ready to make those modifications. But we have staffed according to the staffing guidelines. So if 22-to-1 is the standard that we set for your class, or if it's whatever that standard is in the past, we've staffed according to that standard. But again, the pandemic response team, they're walking around, they're looking at classrooms, we're lining desks up to try to make sure that we can have students in that classroom safe. And in issues where we feel like there's a safety as a question, we're looking for alternatives as well.
Great, thank you, sir. And so families have until 11:59 on Wednesday, 11:59 p.m. on Wednesday, September 23rd to complete those. And then what will happen is Mr. Keith and Dr. Kohler and our team here will be working with principals to update who we expect to see back when buildings reopen. Dr. Kohler, Mr. Keith, any updates on that process you'd like to share with everyone?
Well, I will say that, hi, good evening, everybody. Once those counts come in, that we reconcile that with the commitments we had from the first time. And then we go back to staffing kind of square one. We're going to do that every time we get a new commitment in, our new commitment window, to see how many parents are choosing face-to-face for their students, how many are choosing virtual, and the best way to accommodate the parent's choice with the staff that we have.
Thanks, Dr. Kohler. Dr. McFarland, a question that we got a lot submitted early, we saw some themes there had to do with in-person instruction and actually ventilation and air circulation within our buildings? I know we have some updates on that and things that we've been looking at with our pandemic response teams.
So yeah, so that's definitely important. We know that ventilation is critical as it relates to transmission of the virus, and actually mitigating the transmission. And so where possible, we will encourage classroom doors to be open, and that's different than what we've done in the past. In the past, we've said that all doors need to be locked. At this point, when we have safety vestibules in buildings, which is, I believe, in all of our buildings, we have that. And we're going to be very restrictive at who we're allowing in the building. So we want the doors to be open. Would like the doors to be open so that can increase the airflow within those buildings. We are also considering piloting at a couple of campuses some ionization machines that will allow us to engage in some purification of the air. Some of our buildings we know are older, and with those we'll be kind of piloting that, and it's something that if we think it makes sense for us to be able to eventually consider that in all of our buildings. We know also some of our classrooms have windows that don't open, and so that's not an option for everyone, to open windows and all. But opening doors and keeping airflow just within the building is something that we are definitely considering, and especially with that pandemic response team, we're looking at that and we'll be emphasizing it.
Absolutely. One thing we didn't touch on when we were talking about class sizes, but also air circulation and air ventilation. The CDC has now come out and said that face masks are one of the best ways to prevent the spread of COVID-19. In some ways, even better than that potential vaccine that's not even out yet. And so I know Dr. McFarland, you and Nurse Misty Van Kampen, who's on the line, are releasing a video about the benefits of face coverings, what's allowed and what's not. We have some questions submitted by teachers in advance. What are we going to do to enforce face masks, not only for students, but also for our employees?
So, both for students and employees, a face mask for our purposes will be considered a part of standard dress. And so the things and actions that we normally take in order to enforce dress code, we'll be doing that same with masks. Of course, we would want, the first is just kind of counseling with the student, counseling with parents and all. We wouldn't want kids suspended because they don't have a face mask. What we want is to make sure that we have face masks available on campuses, so if kids show up without one, we can give them one. We don't want this to become a disciplinary situation. If it does, then we'll deal with it as we have dealt with all other dress code infractions. But our first goal would be to try to make sure that they have masks, students have masks, and that they're wearing them. If they're not, then we give them one and then deal with it as a dress code violation.
Great, thank you. And I hope you all saw on our website and social media yesterday, we released a graphic about face mask expectations based on CDC guidance. The ones that work best are the cloth that cover both your mouth and nose, of course, talking about avoiding the face masks that have the air vents on them, neck gaiters. Nurse Misty has been working really hard with her team and keeping up to date on that, the science that's changing. We've seen recommendations change. Some we thought used to work, there's new guidance. And so we're trying to stay up to date on that. And we know it's confusing and it can be frustrating I used to wear neck gaiters because they were really convenient for me. But then when I found out they're not as effective for me or my coworkers who are around me, I switched to this style. So we're just trying to keep our families updated and provide that education so that folks know what works, because we know it is changing.
Right. So hey, Kirshner, can we go back to the question relative to class? I don't think it was class size, but just the classes and virtual versus face-to-face and all that, because I think I kind of oversimplified it. I want people to understand how complex of a situation we have.
Absolutely.
So for example, like all of you right now have classes that are virtual. What we do know though is that we also have face-to-face, or will have face-to-face options of face-to-face classes coming once we get all the final tallies for the surveys, which we have, and we'll be releasing those, I think, Thursday or Friday. So the challenge is that students will have the option as we progress throughout the year. They have the option every 6 weeks to either go virtual or face-to-face. And so, unlike other years, quite frankly, teachers, I just got to be honest with you. Unlike other years, this is a situation where you may start off on October 5th with a group of 15 kids or 20 kids or 22 kids, and you may find out that we have 5 of those kids that decide to go virtual, or maybe you have 15 of the 22 kids that go virtual. So now you only have 7 kids left, and so we then may end up having to take those 7 kids and level to another class, and so it's going to create quite a bit of variability. And so what it means really is that collaboration and collaborative planning is even more important and more critical in this environment than it ever has been, because you may be working with students from different that have been in with other teachers in the past and all that. And so I just want to emphasize the fact that as we start on October 5th, recognize that November 5th, you may have a different class, you may have different kids, you may have, and so it's so important that as we're planning, that we're planning together and that we're moving along our scope and sequence at a pace that makes sense. It's also important for us to realize that as the information and the data and the science around this virus changes, and as we get information, then we may start October 5th, and then by October 15th, we may be back all virtual. And so it's going to be important for us to plan and be prepared to pivot when we have to. And so it's going to be, we're all entering uncharted territory. And so we will be extending grace, and we're going to be asking you to extend grace to us, because we're making decisions based on the most present information, and that information is not always the best information that we will have available, but it's the information we have at that time. So just wanted to kind of emphasize that point, that it's going to be a moving deal all year.
Great. Thank you, sir, for explaining that. We have a couple of follow-up questions related to that. One person asked, when you say leveling, will students be bused to other campuses? So I guess that's the students that have selected in-person learning. And if, let's say that their class is full, would students be reassigned to another campus? Overflow campuses, I think, is what we normally would call that.
So we have as a guiding philosophy to minimize change for families first as a priority, and then second is to minimize change for teachers. And so if there's a way for us to serve that student on that campus without transferring them to another campus, then we would do that. But I can't right now take that off as a possibility. Just like I can't take off the table as a possibility that teachers may start on one campus but be transitioned to another campus due to the numbers. Again, it's right now we got to keep all of our options on the table to make sure, number one, that we maintain a safe environment, but number two, that we serve kids to the best of our ability. But then number three, we do have finite resources. And the reality is we have to make sure that we're using our teacher FTE units in a way that makes sense fiscally as well. And so basically interpretation of what that means is if we have 7 kids in a class, it's likely that we would not have a face-to-face class with 7 kids, but that teacher may either end up getting additional kids, or we may be transferring that teacher to a place where kids are.
Great. We have a question from trustee Lindsay Benton. She's wondering if Crowley ISD has received all of the PPE, personal protective equipment, that was to be provided by the Texas Education Agency. I know we've received a lot. Nurse Misty, have we received all of that?
We've received all that they have received in. We never received the gloves, and my last communication from Region 11 was that we probably wouldn't receive those gloves due to some complications with overseas and where they were getting those gloves from. So that's everything else. We received the hand sanitizers, disposable masks, cloth face masks, face shields, PD cloth face masks, and thermometers from TEA.
Nurse Misty, I know you probably don't have the examples to show with you right now, but in the video you did with Dr. McFarland, oh, look, you may have them, to talk about what we'll have there in the schools for students, both secondary and elementary.
Mm-hmm. My mask bag, hold on.
Thanks for being prepared.
So this one is for our elementary, the PD. It's quite smaller than the ones that will be for our staff, as well as, you can just kind of see the size difference. These will be all secondary, and all of our staff will receive at least one of these. And then all of our little guys will receive one of these.
Ms. Mary Ayers has a question to follow up with that is, will those supplies be replenished?
Well, these are reusable. So the thought behind these, and we go over this in our MAS video, but you would launder these as you would launder them with your regular laundry every day. These are, to be cleaned and worn again. We do have we only have enough really for every kid to get student to get one of these. We'll have additional backup. We have more of the larger masks, and we do have PD disposable mask and adults disposable mask as well from the state level that we will replenish. Now, remember, the disposable masks we give you for your classrooms are for when these get soiled, or when maybe the kid's mask breaks or something happens, right? Because that's just going to happen. So we want to be prepared, so that you just will need to let your campus nurse know when your supplies are getting low. About, I give 3 to 4 days out, so that we can make sure that we get those to you in a timely manner.
Okay, thank you. And what about the disinfecting supplies, the wipes, the hand sanitizer, those kind of things that we have in the schools and in the classroom? We'll be replenishing those as well, correct?
Correct. Yes.
Right.
You just need that communication with us is going to be really important to make certain that we're getting those replenished on a regular basis.
Okay.
Hey,
Dr.
Kirk.
Marfallo? Yes, sir.
So we have a couple questions in the chat. So one is about the Fort Worth ISD school board
Yes,
meeting
sir.
decision tonight, and will it impact our decision to open or not open on October 5th? And so I can tell you that definitely what happens in Fort Worth has an impact on us. With 80% or 85% of our campuses being in Fort Worth City, we know that we got to pay attention, and we are paying attention. However, our decision will be made based on the Tarrant County data, the science, the recommendation, the positivity trend. That really would be something that will be a key indicator for us. So as I mentioned before, it will be September 28th to almost October 1st before we change our decision. Our current decision is to start October 5th. We don't anticipate reviewing that decision until September 28th to October 1st, just because we recognize that if we review the decision, well, when I say review the decision, if we decide to change it, then we will let you know as early as possible, but we'll need to be able to make the decision as late as possible, because things are changing so much. So it'll be a game time decision is what it'll be.
Great. Next question there in the chat for Kylie Soto's asking, the solution for campuses having no Chromebooks. We've distributed out Chromebooks to all of our students to have at home for virtual learning, but as campuses reopen, we know that there's a need to have those Chromebooks. And so I know our technology team is working really hard to get new supplies, but also we'll be encouraging students who were given a device to be taken home to bring that to class with them, correct?
Yeah, that is correct. And I'll let Mr. Keith kind of jump in there in on this one as well. But yeah, we're expecting them to bring those devices with them to school. But Keith, you may want to jump in and add to that.
Yes, sir. And that's exactly our plan, is for students who've been issued a device to bring that with them And then also for teachers, I know we're talking to an elementary group right now. So for teachers to continue using Seesaw, throughout the week in your face-to-face classroom, for a couple different reasons. One, we've asked families and parents to make a commitment to that platform. And so just continuing to use that so they keep going there. But then also if we have to pivot to something virtual, either for that class or for a building, students are comfortable using that platform.
Yeah.
Great. Thanks, Mr. Great questions. Thank you. Next question, questions about school supplies. We had a lot of supplies donated and distributed out to homes for students to use at home. But now that we'll have kids come to the building, how are we going to make sure that the schools and the classes have those supplies that they need? And Dr. McFarland, I know we're working really close with our community partners to receive donations and get those distributed out to schools. This year, we did our school supply list a little different. What we asked parents to purchase was just the bare necessities. And we said, here's what the district will be able to be providing. I know a lot of those, our first priority was getting those distributed for at-home learning. But now that we have students coming into buildings, we will be working to get the supplies that those teachers and individual schools need.
Right.
And we have a couple of questions in the chat about dividers or protection for classes. We know we've seen what we're doing in our cafeterias, but specifically for guided reading has been an example that's been asked about. And so the need to get those kind of dividers. I know we have some portable providers that maintenance, Mr. Reeves and his team have purchased. Nurse Misty, is there any other additional information you're able to provide about those dividers that we see that are easy to move around and clean and sanitize?
I know that that each campus is getting, I believe that there was 100, and Mr. Reeves would have to correct me if, it's 100. So
yeah, that's correct. We've delivered to all the campuses 100 of those devices.
Perfect for that classroom, yes.
So when you say 100, Mr. Reeves, so like if I'm a elementary teacher at the early grade level, so how many would I have in my class?
Well, that determines that's at the administrator's discretion. We just delivered them, didn't have them assigned to any specific location. I know Mr. Keith, been working with him, and off the spreadsheet that identifies where it's needed at what grade level.
Mm-hmm.
But yeah, we've kind of, in talking with the principals, we're making them aware of that. We're doing our walks this week, just making sure that they get distributed to the proper location.
Got you. So I know that we intentionally purchased some for the cafeteria. So are the ones that we're using in the cafeteria, are they able to be taken into a classroom, or are we saying that we have additional outside of the ones that are in the cafeteria?
Yes, sir. Of the portable, we have additional. Now that we've done the 100 at each campus, we're getting feedback from any additional needs, especially those that have the pre-K3 needing additional units. So we're delivering those also. We've got a pretty good supply here at the warehouse, so we'll have some flexibility on how many we can deliver to each campus. Right. That is above and beyond what we initially delivered for the staff to have, and then also above and beyond what we're doing in the cafeterias.
Gotcha. Okay.
And Dr. McFarland, just to piggyback on that, working closely with Mr. Reeves and his department to make sure, and the question was specifically about guided reading, to make sure that teachers do have access to those portable trifold shields when they're working at a guided reading table in small groups with students. So those are there on campus, and like Mr. Reeves said, specifically for the administrator to distribute to anyone who would be conducting small group guided reading for their students at those kidney-shaped tables, typically in the back of the room.
All right.
Great. Some questions coming in about what would happen if a class needs to quarantine based on a COVID exposure or case there in the class. Asking, would we flip over to virtual learning during that time so that no instruction would be missed? And that is the plan, is that if and when a class needs to quarantine, we have our system and our structures in place to be able to transition to virtual learning so we're not missing instruction. Sometimes the recommendations from Tarrant County depending on the case and what the exposure was like, is to quarantine for 14 days. And so we know that we don't want to miss 14 days of instruction. And so that would be our plan, is that if there is a need to quarantine a class or a grade or even a school, we would transition to virtual learning. Mr. Keith, you want to talk about how that process will work?
Absolutely. So one of the things, if you can think of a benefit of the fact that we had to start school virtually this year, is that our students and our parents are at least acclimated to virtual learning. And so like what Anthony said, the goal would be to be able to pivot. So if we do have to quarantine a group of students or a classroom, then the goal would be really to just that next day flip right over back to virtual instruction and continue with the structure that we've used during the month of September.
Great. A question just came in kind of related to this topic about, let's say a case happened with a specials teacher who was exposed to either a student or someone else, and they need to quarantine, and they see, multiple classes in a week. The quarantine would work the same way, right, Misty?
Yes, it would. Yes. But the hope is that that teacher is keeping that social distance from those students, right? And that they're wearing their mask and their PPE and all of that as well. So.
That's a good transition to this question asking, so what is the procedure if someone in the building tests positive? Who gets notified? You want to talk through that process, Missy? I know it starts with us working really closely with Tarrant County Public Health Department for their guidance on each and every case, because we know it's different depending on the factors.
It is. It definitely is. And it's different if it's a student or a staff member. So we have our flow chart for if a staff member, and that's located on our webpage. If it's a student, typically the teacher would probably maybe be the first person that's notified of that. It could be the bus driver. It could be anyone. So whoever receives that notification will let the clinic nurse know what's going on with that student, and administration will be notified as well as myself. Then we'll notify and they'll follow up with the parent to ensure that this is a positive case, that we have a lab confirmed positive case. And then that's when we would do our contact tracing, get our close contacts would be notified. We would get that guidance from Tarrant County Public Health of who those close contacts would be based on the seating charts and those things that we've been put into practice in the classroom, in every one of the classrooms, the cafeteria and the gyms. Then we would send out those contact letters and notification and follow up with the family.
All right. Thanks, Nurse Misty. And we know we've had cases over the summer, and we've been able to test our procedures and are getting our guidance from Tarrant County Public Health. And it is interesting because each time it's a little different based on the factors of when the test happened, what the contact was like. So really, it's going to be a case-by-case basis. We also know that the guidance has changed over the summer. How they handle that as they learn more about the virus.
And I do want to say too that, when we quarantine people, where we suggest they're quarantined or they get a doctor's note or get tested because of symptoms, I will say that we've had instances where maybe we've advised because of someone's had close contact with a family member that's had been COVID positive, and then that person ends up COVID positive, but we had no contacts within our school district because we had them under quarantine. So these mitigation practices really do work. Great.
All right, we've got some more questions about those face coverings. And the first is students and staff being provided face shields. I know those are available. Misty has an example there. But Misty, one of the things, and we keep on talking about this video you've done with Dr. McFarland, we'll be releasing next Monday, but those face shields are recommended to be used in addition to a face mask and not to replace unless it's needed for medical reasons or educational reasons.
That's correct. Yeah, absolutely. And if you have a note or a doctor's note, or if that's worked into the educational plan for that student, then definitely. And we do have, I saw a question in there about face shields being provided, and we do have enough face shields that we could provide one for, these are reusable face shields, just like our reusable masks. So there'll be one provided per employee and per student.
Okay. And another face mask question. You talked about washing your face mask like you do your clothes. What happens if you don't? How dangerous is that for people to wear the same face mask multiple days in a row?
Well, it just gets yucky, right? It gets soiled and it becomes ineffective once these are wet. They're not as effective. So I even would encourage people to, you always carry a spare with you. I know that, that's a practice that we do in my household, is that everybody has their face mask and everybody has their spare before we leave. So that if it gets soiled for some reason or it gets wet because we're sweating and it's hot outside, then we have an extra one as a backup. But it is important to clean those daily.
All right, thank you. All right, Mr. Keith and our technology team, here's a question about Chromebooks being used during in-person learning and just the need for extension cords, power strips, just to stay charged and remain charged during the day. We know what it's like to be in all-day meetings here at central office or with principals, and those batteries don't last all day, and you got to kind of start plugging in and sharing those chargers. So has that been something we're talking about and looking at how we make those last throughout the day?
So that's definitely a consideration. One of the reasons that we went with Chromebooks as a device is just because of the duration of their battery life over a laptop or an iPad. And also in speaking to several principals, I know that many of them are already making investments in those longer power strips to have in the classroom. And additionally, the Chromebook carts that exist on campuses are still there. So even though the devices may have been pulled out to be distributed to students, the power strips that are in the back of those can also function as charging stations for students in the classroom.
Good. Okay, that's cool. Yeah, those carts make great way to charge really easily. All right, Dr. McFarland and Dr. Kohler, we have a question in the chat about substitute teachers and how will we still utilize subs? We have a great partnership with ESS. Actually, did some posts this week. ESS is working to recruit additional subs. Dr. Kohler, you want to talk about that partnership and how we'll utilize our subs during this transition?
Yes, thank you, Mr. Kirchner. So we definitely will have subs. We are in the process of making sure they're trained with our safety protocols, making sure they understand what we expect for teachers in the classroom and what they should be doing to protect our students and take care of themselves. And then also making sure they have training in the virtual platforms and how those work. We do have subs who are eager to get back and work with us. And so our first priority would be to staff a room that has face-to-face students if we have a teacher who's out. And then if we have a teacher who's teaching virtually, we'd be asking them to upload their lessons if they're going to be out just for a day. But we do have some subs who are willing to cover long-term absences like maternity leaves and those kinds of things. And that's where that access and training to log into Seesaw and those kinds of things are important. So yes, our subs are excited to be able to come join us again.
Absolutely. We have great substitutes here in Crowley IC and a really great partnership with ESS going into year 2 with them and really helping us improve our fill rates and really bring some highly qualified substitute teachers into our classrooms. Dr. Kohler, Dr. McFarland, another kind of HR related question here. Miss Cassandra Pable was asking, what happens if your child's class has to quarantine, like your son or daughter, and they're having to quarantine and go home? I know we did accommodations during this time of virtual learning, and we're working with our principals to make sure our parents of children who couldn't be in school were accommodated for it. That will continue even when we go into in-person learning, correct?
Yes, that's correct. And of course, we know as students return back to the classroom, We may have an instance where an employee has to take off because their own child is sick, and that's where that federal Family First Coronavirus Response Act leave is important, because that allows you to have paid leave to take care of yourself, or partial paid leave if you need to take care of a child or someone else in your family that you are responsible for caring for.
Thanks, Dr. Kohler. Here's another question about it dealing with workplace accommodations from, is it Mr. and Ms. Harris down here? Additional accommodations for staff that have submitted their high-risk medical certification. What kind of accommodations are we providing for those high-risk staff who went through that process?
Right. So as we move now from virtual to face-to-face instruction, we have to look at those requests again, look at it specifically. Those are pretty much one-to-one decisions, right? We have to make those on a case-by-case basis. We're looking at providing the shields for those teachers in those classrooms. We're also looking at the possibility of locating their classroom space to a space that's larger. We have some campuses with lecture halls and some library spaces if we need those kinds of additional square footage arrangements to help with social distancing in those classrooms. And we may have some teachers that remain on kind of a telework scenario just because of their health factors and their health risks.
Great. So during today's visits with pandemic response teams, our group got a chance to go over to Jackie Carden Elementary School, and there, Dr. Brooks and the pandemic response team there was, of course, doing a great job. But we also got to take a little sneak into the Child Development Center, where we have children of our own employees who've been, there for 4 weeks, Dr. Kohler?
Yes, 4 weeks.
And how many students, remind me how many students we have at the CDC?
So we have 67 students there, ages 6 weeks to school age in that center.
And in these 4 weeks, the teams there has done a great job. The children are wearing face coverings, lots of social distancing, really putting some of our procedures into place and practice. And there has not been a single case or need to quarantine or have any close contact there. So that's been a great celebration to show that this can work. But I bring that up because someone is asking in the chat about pre-kindergarten and rest time and the spots when students lay down on the floor and how do we social distance with that. And we actually got to see some of the young ones at the Child Development Center today during rest time. Are you going to talk about how that's working and how we're keeping them safe?
Yes, absolutely. So specific to rest time, I mean, it's sort of in the way that we have cots there for our students. So they're sort of laying I guess head to toe, right? You know, you've got one student and then we're alternating the direction on the other, so they're not face to face when they're laying next to each other. I will say, you know, you mentioned the masks and the face coverings at the center, so that's not a licensing requirement. We're choosing to do that with ages 3 and the 3 and 4 year olds because that's what we expect in the school day setting. In the regular building, but we do have students there that do not wear masks. There are infants, of course, do not. We have our toddlers, our pre-toddlers, they're not wearing masks. And I will say it's critical, and then we're not really able to social distance the same way with infants or 2-year-olds. So that sanitization has really been key to that as well. Just wiping down surfaces, coming behind kiddos, after they've been seated together at a table or something like that. Our students eat in their classroom. So the only time they're really able, if they wear masks, to take those off is when they're outside playing on the playground or when they're eating. And they've done a really good job, but it is great to say that as we go into week 5, we have not had an instance with a sick student or a sick staff member. We know it's coming, but it's been a great little test case for us to see if we can make that work with even very young children.
Great. We're very proud of our Child Development Center, and one, just the benefit it offers our employees who are able to utilize it, but just it's a great thing for kids. So thank you, Dr. Kohler, and the CDC team there just doing a great job.
You're awesome. I'm glad you got to see it today.
We have some other questions still about those partitions, especially for pre-K 3 and 4 classrooms. And so Mr. Keith, and we will get with Mr. Reeves and principals and making sure campuses have what they need and can have as many of those partitions for classroom use there that we talked about. Ms. Pitts asking about a specials teacher needing to sanitize supplies between classes, or will each student have their own supplies? And I know that's something our pandemic response teams at the campuses are working on, Dr. McFarland. We heard from that today, visiting art class or music classes, and just the need to either have their own designated supplies or time to disinfect between class periods is really important.
Yes, no doubt, and I believe those teams will work through that. It's hard for us to make a hard, fast rule about at that level from here at the central office. So we're allowing the pandemic response team to kind of make some decisions because buildings are different. What's available as far as physical plants different, and so we are addressing it. It's just we're not mandating that from this level.
Great. And more questions about those charging cords. There was a good point made in the chat that a lot of those cords were distributed during the device handout before virtual learning starts. And so we'll make sure our technology team takes inventory of those carts and just getting as many cords and carts in there ready to go to keep those devices fully charged during in-person learning. And there's a question about our safe return protocols for the community to access and reference. And yes, those went live on our website yesterday. Nurse Misty, I think it's very safe to call that a living document. As we were even going through our campus visits today with the pandemic response teams, we caught some things that we needed to update and modify. And so what you're going to see on the cover page of that document is updated. And yesterday's it said updated 9/21. Today's is going to say updated 9/22. And I have a feeling we'll be making daily updates to that. The other thing that will be going live tomorrow is our COVID-19 dashboard for campuses. And this is going to be tracking our staff cases and our student cases, also our staff recoveries and our student recoveries. We've seen some other districts who are already in person doing that. We wanted to get that live before we started in person, and that's going to be updated weekly. And it's also tied to the TEA. I think Nurse Misty, tomorrow is the day TEA will also be releasing their district dashboards as well. And so be watching for that on our safe return page, that dashboard. And then those videos we've been talking about, that's where we'll be posting those, the face mask guidance, just all the latest updates. We'll even post these town hall meetings on there if you want to share these with your coworkers or if you missed one. So just a lot of great resources there, and check back every day. So like we said, they will be updated regularly. All right, Dr. McFarland, team, we have about 7 minutes until our secondary folks start logging in, and some of them may already be joining us, but we'll just do a transition when y'all are ready. I'm going to keep on scrolling through here on the chat.
Okay, and while you're strolling, I just want to say to the teachers, we definitely welcome any questions that you have, because if you submit those questions to us, then it gives us a chance to think through potential issues and potential challenges. And so please, feel free to continue to submit those questions. We are still making decisions. We're still having some decisions to make. And one is about breakfast in the classroom. We're looking through and seeing if that's really feasible for us. And if not, then what's another option? We also are just looking at how we ensure that on that first day of that first week that we don't have parents walking into the building, walking into the classrooms and all that. And so we're working through some things, and our pandemic response team, we are actually getting closer and closer to some final decisions. But I want you to know we are still in that stage where we are working out how this will be and how this will look. So we appreciate your patience. Another question that we were considering staging, and basically when I say staging, maybe possibly bringing in a grade level at a time, and so that we can kind of transition and get a good understanding of what our protocols will look like. But what we've kind of determined is that because we are really talking about from a face-to-face perspective, maybe 40 to 50% of our kids in face-to-face format, that in and of itself creates a staging feel, because what you can think, the way to think through it is if we have 600 kids at Sycamore and only 40% of them return, then that's not 600. That's actually probably more like whatever 40% of 600 is 240 kids or whatever. And so that in and of itself, just the pure fact that we are also offering the virtual option will reduce the number of students that are physically present there in the building. So that should be able to make most of our campuses feel manageable, but we are of course taking precautions to make sure that we have the things that we need in place.
Absolutely. A couple of questions in here about cleaning between classes, or who does what and what kind of supplies will be used. I know Mr. Reeves, I had to step away, but our custodians at ABM are getting trained in how to properly sanitize. They already did a really great job during normal times and cold and flu season. Our videos are going to be releasing next week. Talk about those EMIS electrostatic machines that now every campus in Crowley ISD has. This sprays a fine mist of sanitizer that's going to be used every evening at all of our schools. But also, Dr. McFarland, as we were visiting with our pandemic response teams, just asking about kid-friendly products and how we can help incorporate our children and our students into, knowing how to properly sanitize their workspace. And that's something that kids of all ages can do, but also we got to make sure that they're kid-friendly products. Right. And so our maintenance team and operations was talking about even something as simple as soap and water can be very effective, and it's also safe.
Yes.
To use.
So Kirsten, we got a question about whether we would address the questions that were sent in. And I think we attempted to, but if there are any questions out there that we haven't addressed, we want to try to address those now. So if your question hadn't been addressed already, please type it into the chat, and then we'll try to address that before we jump off of the secondary.
So Ms. Lauren Webb was specifically asking that. Ms. Webb, I just pulled up your questions. Thanks for bringing those up. But one of them she asked about was the times to disinfect between classes, and of course we want to provide that, but also, like we just said, helping students in that process to disinfect their spaces, and then what disinfecting products will be provided to the teachers. And so that's what some supplies are there, but we know it's not enough to last very long, but also we want to make sure they're kid-friendly supplies. And so something as simple as soap and water, but also easy wipes that are safe for students are among those supplies that we'll be looking at.
Gotcha.
I'm scrolling through here to see what else is being added. Okay, a question about the dashboard, Misty. Will that include the staff that had COVID over the past 8 weeks? Remind me how far we're going back on our dashboard, kind of post-dating that.
No, we're just going back as far as when we started virtual learning.
So to September 8th.
Mm-hmm.
All right. Thank you. Question on here about school hours. Our plans are that school hours are remaining the same. There's no intent to change those hours at this point. Okay, here's a question for teachers that transition from virtually to in-person in October. Will they be required to teach both in-person and virtually? Mr. Keith?
So at the elementary level, we actually, as it stands now, we have the luxury of having dedicated virtual teachers and dedicated face-to-face teachers. So dependent on the way that these change window commitments end up by the end of the day on Wednesday, there may be some changes to that, but overall at the elementary level, we will still have dedicated face-to-face and dedicated virtual teachers.
All right. Question about Fridays. Will those still be dedicated to planning and professional development?
So for the fully virtual teachers, yes, that schedule remains basically the same, maybe with a couple tweaks to match the campus master schedule. But then obviously for face-to-face teachers, it's back to a typical five-day teaching schedule.
Thank you, sir. Someone asked a question about negative tests having to be provided. I'm not sure if that's in reference to if they thought maybe they were positive and then needing to provide proof, or if they were positive and then needing, before they can return to work, needing to provide proof of that negative test. Misty, you're nodding your head.
No, so you wouldn't, if you're lab confirmed positive, we would follow the Tarrant County Public Health Protocol guidance, as well as CDC, which states that you would wait the 10 days after that positive test given that your symptoms have improved and you're fever free for at least 24 hours without fever reducing medicine, you're able to return back to campus. So we go ahead and provide that date for you of when your possible return is. But of course, if you're still having a lot of symptoms, we encourage you to stay home and until those symptoms subside substantially.
Okay, thank you. All right, panelists and Dr. McFarland, it's 5:30. We have some secondary teachers logging on. Elementary teachers, of course, you're welcome to stay. We're going to review a lot of the same information we did at the top of our meeting. But thank you for being here. We plan to do this again next week to let you know the latest and find out what else still needs to be addressed, unanswered questions as much as we can. So I thank you all. Great. The questions are helping us plan and helping us check ourselves and make sure we are ready for students to be in our buildings. All right, I'll be watching for updates. Thank you so much. All right, Dr. McFarland, it's 5:31. Let's transition. We have some secondary teachers logging on, and we are 2 weeks into virtual learning. And I know our high school and middle school teachers have doing a lot to go above and beyond for our students, and we're getting some really positive feedback from the community.
No doubt, we definitely appreciate the hard work. We know it's a different kind of work, but we know it's challenging the same, and so we just appreciate our teachers and other staff who's actually just kind of picked it up and are moving forward and working really hard. And we recognize and acknowledge that it's different. And we thank you for the work that you've done up to this point, for sure.
So we started our elementary group, and we want to start with our secondary group now, kind of talking about Tarrant County, the dashboard we're monitoring really closely from the Tarrant County Public Health Department, and just how we're using that to help us make decisions.
All right, so yeah, let's do that. And what I'd like to do is just take some time to walk you through the decisions we're making and the information that we're using to make those decisions. So you'll be able to at least understand the logic and the rationale behind what we're deciding. As you all know, we have previously decided, and we meaning the board, we previously decided based on the information we had back at the time to return to face-to-face on October the 5th. And so what we've done, and what we've done weekly up until this week, what we've done is we have looked at the dashboard from Tarrant County. On Tarrant County Health Department's website, there's a dashboard that they provided for us now. And this dashboard actually gives us information about benchmarks relative to COVID-19. And we use these benchmarks to kind of judge whether or not it is suggested or recommended that we return to a virtual learning. So I just want to walk you through the dashboard. You all have access to this. It's open to the public. So we'll go in here and we'll select a Crowley ISD. And what it will do is it'll give us a map of our district. And of course, it's color coded. And we know that if it's red, that's not good. And so what you see right now is these are the two high school boundary attendance zones. You can type in Crowley High and you'll see Crowley High zone and the red, and then also you can type in North Crowley and you'll see that it's red as well. Now, we don't just stop looking at Crowley ISD. We have access to information all over Tarrant County, and so we can look at what's going on in Everman. We can look at South Hills High School or Southwest High School or any other high schools that we feel like we wanted to see, Burleson, and we can kind of see whether we're just yellow and everybody else around us is red, or is all of us red. And so what you'll really see when we look at Fort Worth, Fort Worth, the city of Fort Worth, and the part of Fort Worth that is that's in Crowley ISD and Crowley ISD, we see we're definitely red. And so that's on the left hand side. So on the right hand side, you'll see where there's a recommended learning scenario.
Sorry, I had to refresh there.
No problem. So on the right-hand side, you'll see a recommended learning scenario. And so again, these are all just recommendations from the health department based on the science that they're reviewing. They've identified 5 key benchmarks. One is the case rate. Now, the thing that's important is that oftentimes we're looking at stale data or data that is from a time ago. So if you look at the case rate, basically that is yellow, which would be a positive, but that's from the week ending September 5th. And so when I talk about in a second, I'll talk about kind of the decision and being a game time decision. And what I'm saying is that we'll be making decisions based on the most reliable information at the time closest to the start, as close to the start as we possibly can, because these numbers change on a regular basis. So anyway, we look at case rates, you see where that is, that's yellow. When we look at our county 4-week case trend, that is yellow as well. But and again, that's based on September 5th. When we look at COVID-like illnesses, we see that's red for the week ending September 19th. And the 2-week trend is going in the wrong direction. That's red. So that's cause for concern. We look at the hospital beds. Again, the hospital bed occupancy rate is going down, which is a positive. But then when we look at number 5, this one is the one that's really most concerning, and quite frankly, in our decision making, it carries the most weight, and that is the positivity rate. And so right now we're at 11.2, and so that causes grave concern for me as it relates to face-to-face with us having a positivity rate that high. Again, we'll continue to evaluate it. On Sunday, when I was preparing communication to the board, and I looked at the chart, and the positivity rate was like 8.7, and it had been going down. And so at that point, I'm like, okay, October 5th seems like a really possible day for us to return. However, about midday on Monday, it changed, and so now we're 11.2. And so it's just important for us to have some space to be able to take our time to make this decision. I know many of you are aware that Fort Worth ISD will be having a board meeting tonight, and they'll be making a decision to either keep October 5th as their start date or back it up. Although we pay attention to the decision, we want to be informed with what people around us are doing. That will not influence our decision one way or the other. We will focus on the data. We'll look at the data, the science. We'll be in conversation and communication with the health department, and we'll make the decision that's the safest one first, and the one that makes the most sense for the students in our community and the families in our community, and also for you all as teachers. Now, one thing that we did say, if we decide to delay beyond October 5th, we've been adamant about the fact that we recognize that if we were to line 10 of our kids up, then 7 of those kids would likely be in a home where they may or may not have a quiet, safe place. Well, it may be safe, but may not have a quiet place in order for them to do their complete their virtual learning. And so that being the case, we have began to identify what we will call satellite learning centers. And so we are looking at different locations in the community where, and we have several of our churches have stepped up, 5 of our apartment complexes have stepped up, and so we will be creating satellite learning centers. And the purpose is, we know that we'll need it whether we start on October 5th or not, because we know that it's very likely that even if we start face-to-face on October 5th, there's a high probability that in a short period of time, we will have to go back all virtual. And it may be a situation where all year we're going back and forth. And so when we go virtual, we want to make sure that those kids have safe place, quiet place to be able to do their work. And so we're going to be working on that. And so again, we will revisit September 28th and again October 1st, and we'll have some information for you. Right now, we are planning to remain October 5th as our face-to-face start. And so I wanted to let you know that, and that I also wanted to let you know that we have at the district level what we call our pandemic response team. And right now that team is actually a meeting with pandemic response teams, the pandemic response teams on the campus. These are critical teams because they're making decisions that are specific and relevant to that campus. And so we want to make sure we have these procedures in place. So we're actually doing walkthroughs over the next 2 weeks on each campus, and just kind of walking through the face-to-face procedures to make sure that what we think will work will actually work. You know, one of the things I can tell you, you know, we talked about breakfast in the classroom, and just after the initial walks, there is some concern about whether we can actually do that in a safe way. So we're evaluating that. We also have talked about entry into the building and exit out of the building. We want to make sure that we can actually do the things that we believe we can. Scheduling of kids. We're kind of evaluating how we can do that, and if we can do that in a way to where we at least have a controlled group of kids that are interacting with each other. Now, again, these are all decisions that we are evaluating and reevaluating, and I share that with you just to let you know that we are in a constant state of making decisions off of the information that we have. And as the information changes, our decision may change, but we definitely are committed to keeping you abreast. We also are not just relying on our experiences here and our professionals here. We have been since March in communication with an educator from over in China, and she is from the States, but she works over there in the English department in China in a school. And so they are about 3 months ahead of us. And so we have learned a lot about procedures from what she has said that worked well for them and also what didn't work. We actually had a chance to talk with her again on Monday and get some updates. They are now, back to school. Everything is back to normal. No mask, no social distancing, and none of that. And she's just about an hour and a half or so away from Wuhan, China. So what I said all that to say that if we adhere to our protocols and if we're wearing our masks, then there is light at the tunnel, at the end of the tunnel. It's just we got to all stay committed to doing the work that we have to do. And then the last thing is, I know that we've had Project Safe Start underway. We have about 30 people from principals all the way up that have been working on making sure we have a safe start to face-to-face learning. And so these folks are meeting weekly and kind of going through issues. So if you have questions that we don't address tonight, we need you to submit those questions as soon as possible so that we can game plan around those questions. So that's all I have right now. Again, thank you all for the 2 weeks of virtual learning that we've completed. We know it takes a lot of effort, takes a lot of work. It's different, and we appreciate you making the effort.
Absolutely. It's great to see what's happening, see students engaged, and positive comments and feedback from parents in the community. Dr. McFarland, you mentioned in your weekly communication to the school board. Our school board has been phenomenal throughout this entire pandemic. We were able to introduce some of them at the start of our elementary town hall. I wanted to make sure just to recognize those trustees who are able to log on. They're just here to listen. They want to know what questions are being asked. They want you to know that they support you. They appreciate you. And so Ms. Hall, Ms. Davis, Dr. Woodson Mayfield, Ms. Benton, thank you all for logging on. And they're just here to listen. And so kind of some housekeeping. As you all have questions tonight, I know we had a lot of questions submitted. We'll try to run through as many as we can. But as we have questions that you think of or that we're not answering, if you'll just utilize that question and answer chat down on the bottom, we'll be going through that. And it looked like Mr. Charles Knight, one of our attendees, raised his hand. So Mr. Knight, if you have a question, if you're able just there to type it in the Q&A. Dr. McFarland, some of those questions that we received in advance, we saw a common theme with some questions about ventilation and air circulation in classrooms. And I know that's something the pandemic response teams are looking at really closely as well.
No doubt. And we first have to acknowledge that, we make decisions based on the information and circumstances that we have at the time. So what we do know is that in the past, we've had a practice of ensuring that all of our classroom doors were locked for obvious reasons. We do think that's important, but we also understand that now with the pandemic and the impact that circulation has on airborne transmission, we definitely realize that the more ventilation and the more airflow we have, the less likely those transmissions are. And so we are asking for teachers to open their doors and to leave doors open where possible. We know that not everyone can open windows because not all windows open, but we know where we can open doors, we want to do that. We also will still remain vigilant about allowing people into the building. And if our doors are open, of course, that's an added a need for an added layer, and we plan to do that. We plan to keep that moving forward. Also, we are investigating and will likely be piloting, bringing to the board for their consideration, the piloting of some ionization machines that will help us with purification of the air. And we will likely start with buildings that have had issues with air quality. And then if it's something that we feel like makes things better there, then we could eventually have those in other buildings. But again, we are looking at ways to make sure that air quality is where it needs to be, and that ventilation is occurring at a level that helps us to prevent unnecessary spread.
Great. Some other common questions we saw submitted early in advance had to do with class sizes and how will we have any set limits, and what will that look like from campus to campus? And we know secondary classes and the sizes often look different than they do at the elementary level. We also know that this week parents are having an opportunity to change their commitment forms for virtual or in-person learning. So there's a lot of factors that go into that, but there are still a lot of questions we have about class sizes and social distancing along that line. So Dr. McFarland, Mr. Keith, and Dr. Cole, I know y'all are working really closely on those numbers with our principals.
All right. So one of the things is, what we know is that we have staffed our campuses. In the spring, we had to give a projection of 16,000 students or so, and so we had to staff our campuses based upon our staffing guidelines. And for each of the cores, we have staffing ratios, and so we have staffed according to those ratios. We remain as a practice, we still continue to staff based on the staffing ratios. So what that really means is, whatever the staffing ratio was for your class, and it's different for different classes, that will be the staffing ratio that we have for your class once we start face-to-face. However, we do know that as we're walking the building with these pandemic response team, we know that in some cases, the size of the classroom may present a challenge for us in relation to that normal staffing ratio. And so we're evaluating those situations. Dr. Kohler, you may want to jump in on just the kind of practicality of class size and staffing and all the changes that we're having.
Sure. So one of the big factors is how many students are going to return face-to-face. So as we are getting those commitments in and reviewing that relative to the way the commitments from the first window, that's the first thing we're going to look at, is how many students are wanting to be in a face-to-face setting, because you may be staffed for 28 students in a class, but if only 15 of them are going to be face-to-face, then we feel like we can socially distance that. So as we review those, as we look at those counts, we may have to do leveling within a master schedule. We also may have to look at classrooms where a teacher has a heavy caseload. We may have to move them to a bigger classroom setting, potentially like a lecture hall at some of the middle schools. We have some library spaces. So but it all hinges on how many students are planning to return face-to-face. That's really the big determining factor.
And you know, one of the challenges to add to the complexity of this situation is the fact that every 6 weeks, students can choose to go virtual or face-to-face. And so what that simply means for us is that almost every 6 weeks, we're kind of forced into this leveling process. And so what we're asking for is a little grace and some patience. And we're going to be extending that to you all as well, because what we recognize is that you may start off on October 5th with a class of 15 or 20 or 25 or 28, and you may end up with a class of 13, or you may end up with a class of 10 or 7, and then in November we end up you're no longer teaching that course because we've had to make a shift and address issues other places. So you know, I wish there were more, I wish there was more information I can give you that would say, hey, we got it set and this is the way it's going to be. But I can just tell you, what I can guarantee you is whatever we start off doing, we'll have to make some modifications to it. That's what I can guarantee, is that we're going to have to make some changes. And so I know it'll be a little bit uncomfortable for folks, for you all, as it is for me. One thing I can say though is this definitely encourages and will speak to the need for us to have to engage in collaborative planning. It is going to be so important that you are planning with your colleagues and that you all are sharing plans and that you're able to follow the pacing guidelines as much as possible, because it's very likely that a student could have 2 or 3 teachers over the course of a semester, and it's very likely that you could have different groups of students over the course of the semester, depending on what happens with student choices and parent choices. Mr. Keith, you may want to add something to that.
Absolutely. Just to echo that sentiment, that pacing and scope and sequence has never been more important than it is this year, for that exact reason. With students moving in and out every marking period, there's a very high potential for instructional gaps if teachers aren't on the same page by the end of that marking period. What we're not asking for is lockstep day by day. What we are saying is by the end of each 6 weeks, we need to be at the place that we should be in that scope and sequence and in that pacing guide, so that if the student makes a transition, they're on track, even if they have to switch classes or change teachers.
And, along with that, Mr. Keith, you made me think about a question that was asked earlier relative to Chromebooks and use. And I believe for the high school, it's probably not as big of an issue, just because I know at the high school level, you've always had Chromebooks, and so maybe more of an issue at the middle school. But what we do know is the more we use the Chromebooks in face-to-face format, the better, because there very likely will be a situation where kids will have to go from face-to-face back to virtual, and so we want to make sure that transition is a smooth transition and an easy transition for students as well as for you all. Having assignments submitted electronically makes a lot of sense, because if that happens, that will just make it a lot more efficient for everyone, both for students as well as for you. So being able to make Chromebooks as a part of the devices you're having as a critical part of what's happening on a daily basis will be important to do.
All right. Well, we also had some questions submitted in advance about the enforcement of face masks in our campuses, not only for our students when they come back, but also for our adults in the building. Just reminding everyone how effective face masks are. So, Dr. McFarland, we're going to make that part of our standard of address, just like we do our dress code, right?
Yeah, no doubt. I mean, face masks are part of our dress code for both teachers as well as for students. And from our perspective, the message is that you're wearing your face mask to protect yourself and to protect others. And I think we got to constantly remind kids that, hey, this is for your protection. And so we will, if kids are not wearing face masks, we deal with it like we would deal with any other code of conduct violation, and specifically any violation of the dress code. We will also have extra masks or additional masks there on campus, so that if kids show up without one, we can simply give them one and allow them to move forward. Of course, we don't want to get into a situation where we're suspending students or having to take punitive discipline for them not wearing masks. However, we do want to make sure that we're enforcing the mask requirement. And again, that's we'll just build it in as a part of our code and a part of our enforcement of the dress code.
Great. Yesterday, the district released some face mask expectations, talking about the proper way to wear them, the proper ones, relying on the cloth ones that cover your mouth and your nose. The ones we're getting new guidance from the Centers for Disease Control that the face mask with those vents on the side are not as effective. Also that those neck gaiters not effective. I used to wear a neck gaiter over the summer, but when I found out they were not effective at protecting those people around me, I stopped. And so that we have some information now on our website about expectations, release that on social media. And Dr. McFarland and Nurse Misty Van Kampen, who's here on the line, we've put together a video that'll be released next week, just talking through what our expectations are, what the district's providing. I know Nurse Misty has some samples to show what we'll be providing. That right there is a secondary level mask, because it's a little larger. Misty, kind of show that size compared to the one we're providing at the elementary campuses.
And this is the one for the elementary campuses. So you'll see the difference in size.
we provided for every student in the district. Also, she has one of those face shields we've talked a lot about. There's some information about those on our website and flyer. Nurse Misty, face shields are not necessarily or a replacement for a face mask. They're a great addition to that, but we're not talking about replacing face masks with face shields unless medical needs
Mhm.
or also educational needs, where a student needs to see a teacher's mouth or vice versa, as teacher needs to see a student's mouth, right?
Correct, correct. And so they're not a replacement for a mask, but there are certain instances when they provide some form of protection, which is better than no protection whatsoever. So, so with those students with medical needs or in instances where there's a short-term educational need there, they're appropriate. Yes.
Great. Thank you. And we know that the guidance changes. What was maybe effective or advised last week may change next week, and so we'll continue to update those rulings and guidance that's issued, and just ask folks to just kind of help them learn, make it a learning process, and just ask them to be flexible as we go through that. Dr. McFarland, we have a question here in the chat about social distancing in the classrooms and how we're going to maintain student and staff safety if we're not able to keep that 6 feet of social distancing at all times. And that's one of the reasons why we're requiring face coverings to be worn at all times.
You're absolutely right. And the number one strategy, the one strategy that's proven most effective has been the wearing of face mask. Without face mask, of course, 6 feet makes a sense and protects you, adds a degree of protection. But the reality is the key protector based upon the current research, the most recent research, is the face mask. And so although we don't have the space in every classroom to keep students 6 feet apart, so that's why it's going to be critical that we just make sure that kids have their mask on. And then the kind of guidance has been, and Ms. Van Kampen definitely correct me if I misstate this, but the guidance have been that if, for example, if there was an exposure, the question that we ask is, have you been within 6 feet of someone for 15 minutes or more without a mask? And so if you've not had a mask on and you've been within 6 feet or more with no mask on, then I believe, is that right, Misty? Correct me if I'm wrong.
Well,
Correct me.
so regardless of masking, if you've been within 6 feet for a prolonged period of time, with or without a mask,
Okay.
you would be considered a close contact.
Okay. All right.
And that's one of those things that
That's our Tarrant County Public Health guidelines. Yeah.
right. And we work really closely with Tarrant County Public Health because we know it changes, their recommendations, what they were saying before, as we've seen it change. That's why we work with them on every case, because as there's been confirmed cases or close contact, handling it on a case-by-case basis and asking, okay, here's who was in the room, here's who was exposed, what are our next steps?
So yeah, and to your point, Kirshner, it was not until not until I met you all at over at Alley Middle School the other day, and we were getting ready to do the video on masking, that I realized that these gaiters are no longer recommended. As many of you know, we bought gaiters for all of our kids that are in athletics and band and all of that, but now these are no longer good. And they just said that last week. And so now we're having to come back and reissue and all that. And so I just say that just to say that things are changing. We're staying current. Misty is just doing a phenomenal job. I just want to stop and say that. I mean, there is not one situation that has occurred since the pandemic started where we hadn't relied on Misty's her intellect, her connections, her knowledge about health science. And so we are blessed and fortunate to have her, because she's able to keep us informed and keep us current. So thank you, Misty, for all that you have done. And it's been a lot. I mean, and people don't realize it, but it has been a lot. And so we appreciate you. We want you to know that.
Absolutely. Hey, a question here in the chat, and teachers, as y'all are on, as you'll just keep on adding these questions here in the chat, so we make sure we're getting what is hot on your mind right now. What about when students and teachers need to drink water, eat, or even when they need to sneeze? You know, I've had to sneeze in my mask, and my first thought was to take my mask off to sneeze, but no, that you want to keep your mask on while you're sneezing. That's right. Like that's when you need it the most. So you're not, spreading germs. Yeah. So into your elbow. That's great. I know it's gross, but also, so in cafeteria, masks will not be required in the cafeteria. Students are sitting at the table, but that's because we have those plexiglass partitions at every cafeteria table in Crowley ISD. And so that's one. And then drinking water, we also know that there'll be mask breaks, allowing times for students to go outside. And we know having one of these on for 8 hours just is not reasonable. And so just opportunities for students to take mask breaks and staff. So we know that it's not possible to keep it on all day, every day, but definitely as much as possible.
Right. And also another thing, and Mr. Reeves may be able to address this, but I believe I saw a picture on Twitter because I retweeted it. And it was dealing with refillable water bottles.
Yes.
And so we have, I believe we have installed, go ahead, Mr. Reeves, why don't you share? Because I just saw it on Twitter and I tweeted. I said, that's pretty cool. All right.
Yes, sir. So we've installed those units at Best Race, Pointer, and Sioux Crouch. The rest of the units will come in probably in about 3 weeks. The reason we installed those three is that was the type of manufactured unit that came in. But yeah, they're going to be there. There you go. Typical spec for us now. This is similar to what we put into June Davis. And moving forward, even after we go back and retro everything, moving forward, that will be what we're specing in the new facilities also.
So I know in our video, we were encouraging kids to bring bottles of water that can be refilled so that way they can still get access to water, but we'll be discouraging using the water faucets the drinking fountains if we have these in place, for sure.
Yes, sir. And we're also providing extra water bottles at each campus.
Okay.
And in addition to the video, that's something we actually put on our school supply list for this year. We really thinned down our school supply list to make it easier for parents. But one of those things on the school supply list is that reusable water bottle with a lid, just to have those. And not only good to help prevent the spread of germs, but also good for the environment, reducing the disposable water bottles that are used at our campuses. So Mr. Reeves and the operations team being forward thinking, ordering those and getting those installed. Dr. McFarland, you retweeted that, and on Facebook and Twitter and Instagram, that has been a huge hit. People are very excited about those being installed in every school in the district. Okay, well, here's a question in our chat about restroom for secondary schools, a plan to regulate occupancy. Kids love to gather there. That is true. And Dr. McFarland, we were with our pandemic response teams today, and that was something we realized we're going to need signage for our restroom facilities, both at the secondary and elementary school. And what we talked about with the campuses we were at today was limiting it to 2 people at a time there in the restroom so they can keep their distance and stay safe and social distance there in the restroom. So that is a great question. And that's something that came up today from our site visits with those pandemic response teams.
Right, and that's why that's really that's an example of why we need these pandemic response teams, because these teams are actually remember your colleagues that are on your campus, and every campus may have a few different nuances about how you access the restrooms, where restrooms are located, and all that. And so that's one of the decisions that's will be a local decision by that campus. But what we're doing is trying to make sure that we can get some consistency at the expectation level across the board, but your campus and how it's implemented on your campus will be based upon your principal and the pandemic response team.
Absolutely. What other questions? No questions are coming through on the chat. This is y'all's chance. You have district administrators and principals on the line as attendees. What do y'all need us to be thinking about?
So I think while we're thinking, since we have secondary, we do know that we have a Crowley versus a North Crowley football game this week. We will be, I don't know if Mr. Lincoln is on or not, but maybe you could type in the chat if you are, Mr. Lincoln, if I misstate something. But what I do know is that we are expecting 35% occupancy, that tickets will be purchased online. I think I see Mr. Lincoln popped on. So, Mr. Lincoln, can you just give us a high-level overview? I know at the board meeting we're going to talk a little bit about the start of athletic season, but Mr. Lincoln, if you can give us a high-level just overview of what we can expect with athletics in both volleyball and football and cross country.
Okay, can you hear me, Dr. McFarland?
Yes, sir.
Okay, good afternoon, everyone. As Dr. McFarland stated, this is the week that we will have Crowley High School versus North Crowley varsity. Well, it'll be all football games. The sub-varsity games will be at the campuses. I believe freshmen will be playing at Thursday at North Crowley, and the JV will be playing at Crowley High School. And the varsity game will be at 7:30 Friday night. All tickets will have to be online purchased. We will not be selling any tickets at the gate. We're trying to become a contactless school district in regards to tickets. So all tickets will have to be obtained online, and that process is on our district website. As far as volleyball, it's gone really good. The UIL, as you well know, has given us some recommendations for mitigation, and which includes the facilities not being utilized at 100% capacity. They're recommending 50% capacity, but to keep you and all the other stakeholders safer, we're about 35% capacity. And so far, everything has gone well. I've been to several of the volleyball matches, and the mitigation plans are being followed as presented. And so we're anticipating that being the same as when we have our football games as well. Those facilities will also be marked. So, and we will have more information posted tomorrow on our website in regards to the mitigation process. So we're excited to be able to, first of all, have activities. It's been something that we've been out without for a while, and I know that all of our fans and spectators and stakeholders will follow those mitigation rules that will be posted and asked of. So thank you, Dr. McFarland, for having an opportunity to visit. And is there anything else I can add at this point? I don't have a problem doing so.
Just as it relates to a band and cheerleaders, are we expecting to have all of the students, student groups there and participating?
Thank you, Dr. McFarland. Yes, this first game on Friday night, the varsity game, will be a opportunity for our student groups to actually come and occupy seating within our stadium. What we're using that as is an opportunity to review our mitigation plans, and our tickets will be for the parents of the players and the support groups. And with others that are interested in following us, we will be streaming those games on our district YouTube. So, and we're excited because it's going to give us an opportunity for Crowley to mitigate their side, North Crowley to mitigate their side. So as we move forward with having our own games at our respective facilities, that we'll be able to say, wow, we've had on-hand training and be able to mitigate that at a more safer opportunity.
All right. Also, just for information, we are preparing a day in the life simulation, so you can see what to expect during the life of a student going through a face-to-face experience. But I can just tell you at a high level from your vantage point, or from our vantage point, what we're asking you all to do as teachers, we are asking you to check to make sure kids have their mask on, that to social distance where possible, and to check temperatures at the beginning of the day. And I do believe that everyone we purchased temperature devices for every teacher, and so those are going to be important strategies to help us to mitigate any possible exposure. But again, these other programs that Mr. Lincoln just mentioned, they've been going since June, and so we have had situations where we've had infections, and so we have had exposures, and so we have put our protocols in place. And the thing I'm proud about is the fact that we are continuing to use our protocols, and so when a positive case is discovered, we immediately follow our protocol. And I think that's so important. We know that we will have cases, and the main thing is that we just follow our protocols, and that's what we plan to do. So we also have our protocols that'll be available if you're interested in that as well.
Mr. Lincoln, while you're still on the line, we had a quick question about tickets for freshmen and JV games. Are those also sold online?
Yes, sir. They are also online and available. I want to say they went live yesterday morning about 10, and that's one of the processes that we in the athletic office are monitoring daily is with our online services, we're able to see how many tickets are being purchased, and it also will lock in the amount of capacity that we have in the stadiums and will not allow us to sell any more once we reach that capacity. So those tickets are online. Yes, sir.
Thank you, sir.
So Mr. Lincoln, just a question, and this probably is a basic question, but let's say I showed up to the game and I don't have a ticket. I'm assuming that I can go on my phone and purchase a ticket at that point and get some kind of notification that I bought a ticket?
Yes, sir. Once, not for week one in regards to Friday night, because we've explained those attendees what the restriction will be. But yes, we will have QR codes available. Like for instance, at the volleyball matches, we realize that some people will not or have not had opportunity to go online. We have a QR code that's by the check-in area where you can check in and you can actually purchase a ticket while you're in line.
Gotcha. Okay. Look like we have a few questions.
Yes, sir. Yeah, we've got a few more coming in here. A question about students or staff that have cold and flu-like symptoms, which sometimes are very similar to COVID-19 symptoms. Nurse Misty, how are we going to determine in our clinics who can stay and who needs to go home? This would be a great opportunity to talk about a new telehealth partnership with virtual care for families.
Absolutely, Mr. Kirschner. Yes, we do have this new partnership with Virtual Care for Families. And if our parents have opted in, and we can also do an opt-in at the time they present to the clinic as well. But what that would be able to do is let us know exactly if we're dealing with COVID or not. So the COVID test that's available is 97% accurate. It's a rapid antigen test, and we would know within 12 minutes if this student would be COVID positive. We also have the ability to test for strep and flu as well, because we are coming into flu season, and at the same time that we're coming back face to face. So there's more diseases out there, there's more illnesses than just COVID-19. And we always have to keep that in mind. But I will say that the guidance for Tarrant County Public Health, and we always rely back on them because they're the experts, and that's where we get a lot of our guidance from, most of all of our guidance from. And what they would say is that if you present with symptoms, you need a doctor's note with an alternative diagnosis or a negative test.
All right. Thank you, Nurse Misty. And along that line, Dr. Kohler, we have a question here from a staff member asking if they are exposed to the coronavirus and need to quarantine for 14 days. Will they transition to just teaching from home during that time? And also this could be a great time to talk about the leave and how that works as staff needs to do that, either for themselves or for their own children.
Right. Thank you. So I think the question was if someone's exposed, so they may not be diagnosed, but they have an exposure, what happens if they need to quarantine, and can they teach virtually? And certainly that telework is an option. We kind of have to look at that case by case, just depending on if someone's diagnosed or is just an exposure. I will say that when we now have students in the building, we have to make sure that classrooms are covered. So if we have face-to-face students in a classroom, although the teacher may be delivering that instruction remotely, we still have to utilize our subs and those kinds of things to make sure our students are monitored in the classroom. You mentioned, I think, Mr. Kirchner, too, the Family First Coronavirus Response Act leave. So that leave does provide paid leave if an individual, an employee is diagnosed with COVID or needs to quarantine, and it provides partial pay if you're caring for somebody who's been exposed or diagnosed. So if you have a specific question about your specific instance, we can certainly take those in HR and walk you through that leave based on your particular scenario.
Thanks, Dr. Kohler. While we have you unmuted, here's a question about teachers with underlying medical condition and that workplace accommodation process we've been through. Will those accommodations that have been granted, will those continue now that in-person learning is set to begin?
So they'll be reevaluated, certainly, and we have a committee that looks at those, and it'll depend really on the medical documentation and what the severity of their medical needs are. I will say, as much as possible, when we are going to make every effort to accommodate so that a person can teach in our buildings on campus, but we know there are some folks with some really serious concerns, and we may have to extend those telework agreements. Great question. Thank
you, ma'am. Dr. McFarland, we have a question or more of a comment on here about campus implementation and kind of let's talk about the why behind our pandemic response teams. And we know the district's providing a lot of guidance and protocols, but we are relying on our campuses to actually come up with the how. At the district level, it's been a lot of the what, and but we know at the campus level, it's been the how. And so we talk about why we're doing that and why we're relying so much on those pandemic response teams.
Gotcha. And I guess what I like to do is just kind of go in a take a step back. So we have we have a team that meets on a regular basis called our Project Safe Start. And so the Project Safe Start at the district level is really that kind of overarching guiding a team. And what we have done is we've considered really global decisions that we can make at the district level. We feel like these are decisions that should be implemented across the board and really in a consistent manner. Wearing masks, checking temperature, having one entrance and one exit. Like those are global things that regardless of the shape of the building or the geography of the building, those are global things that we feel like we can make a decision on and need to because we have the information we need in order to do that. But there are other decisions that we have to make or that need to be made, but we believe that they need to be made by a team of people who are closest to the implementation of whatever strategy that is that we're considering. And so on every pandemic response team, we have both people from that campus, but there also are district representatives who are assigned to that campus and who will be a part of that team at different points in time. And actually this week, we are actually doing walkthroughs with each campus, with each pandemic response team to help them think through possible challenges. And then also for us to be able to identify possible challenges that we may not have thought about while sitting here making decisions. And so we did not want to just sit here and make decisions blindly. We wanted to be able to have people that are closest to the building, that know the building a little bit better than we do, and give us their insight. Let me give you an example. So one of the decisions, early decisions, our thoughts was that, hey, let's do breakfast in the classroom, because we were trying to minimize transition and minimize student exposure and all that. Well, you know, we looked at some of the elementary classrooms and even I think at some of the secondary classrooms, and we just felt a little bit uncomfortable with saying that we're going to have breakfast in the classroom across the board, recognizing that we can't necessarily keep everybody 6 feet apart And if they're having breakfast in the classroom, they have to eat, so they have to take their mask off. So now we have these small classrooms with masks off, they're eating, and maybe it's not as good of an idea as it sounded when we were on Zoom kind of thinking through globally. And so the pandemic response team helps us to get a different set of eyes closer to the problem. No campus, though, quite frankly, this pandemic is such that anybody making a decision in isolation will likely be wrong. And so what we do believe that even though we're saying there's going to be a decision that's made by that campus pandemic response team, is also going to be the pandemic response team, the decisions they're making will be supported by central office, just not directed by central office. And so we're figuring this out together, and we'll be working through it together, but we just think it's important for us to walk the building, and we think people in that building should help us make some of those practical decisions.
Absolutely. Dr. McFarland, an example of something that the district kind of directed for all campuses and all classrooms. Miss Melinda Jones here asking a question about it. Are we checking temperatures before a student enters our classroom? Yes, that's an example of something that every teacher, every classroom is going to be provided with those thermometers. And that was just a protocol we put in place, and those pandemic response teams are figuring, okay, how that's implemented. But the district made that decision that we will be checking those temperatures every morning as students enter those classrooms. And so that is a great example of that.
Right. And also I think, and even like right now, like every adult should be getting their temperature checked, when they enter the building. We also know that when kids enter our building, then we should be checking for masks. We're not checking temperature, we're checking masks. Before they enter the classroom, that's when we check for temperatures. And so it's just important to remember that the key strategy for mitigating the spread is wearing of the face mask. That's the most important thing that we can do, is to constantly remind kids and reinforce students that we want them to wear a mask, and adults. And so reminding your colleague to put a mask on is important as well.
Absolutely. And part of our communication with our parents, we mentioned these videos in the Day in Life video that we're producing. It starts at home. We're encouraging parents to take their children's temperature before they leave each day for school. And so that'll be a huge educational piece for us, and just making sure that threshold that we're looking for, Nurse Misty, is anything below 100 degrees.
Correct. Yes.
All right, here's a question about how much information will be shared about students and staff on our campus who may test positive. And so this is getting that information out, but also protecting medical privacy. And so, Nurse Misty, we kind of have a couple of things here. The communication that happens if you are in close contact with a confirmed COVID case.
Yes. So if you are a close contact, you'll receive a letter that is from Tarrant County Public Health Department. We share that information with Tarrant County Public Health Department because they'll want to follow those close contacts. We gather the contact information and the positive case information, and we share that. We protect the privacy of our students as well as our staff that are involved. And it's really just a need to know the nurse at the campus, and typically the campus principal would know, but not, and of course the teacher in the classroom if that student was in the classroom.
Okay, thank you, ma'am. Dr. McFarland, a question here of going back to face mask and just the making that part of the expectations and dress codes. Teacher was asking, but what actually do you want us to do, teachers, when our students are not wearing the face mask? So what would be the best way to handle that if the student refuses to wear that face mask in class?
Well, so the first thing is, if they are in the building, then they have a mask somewhere, because somebody, hopefully when they came in the building, would have asked them to put a mask on. Hopefully as they're walking down the hall, if they're walking down the hall without a mask, hopefully several people have asked them to put their mask on. And so what we have to do is, like we would do with any other kind of dress code violation or any other kind of violation, we need to just constantly reinforce the fact that you need to wear your mask. We also will have masks available for kids who possibly leave a mask at home, or get a mask damaged, we'll have those available as well. What we will not be doing is suspending students for not having a mask on. We'll give them a mask. And so that's really what I would ask you to do is ask them to put the mask on, and then let's give them one if they don't have one.
Right. Thank you, sir. Here's a question, Nurse Misty, about, let's say a student in a class is diagnosed with COVID. Does the entire class have to quarantine? And that's where we get Tarrant County Public Health involved, right?
Yeah, absolutely. We partner close with them and go off their guidance. That's why seating charts and are just so critical at every level, especially the secondary level, to know who that student was sitting around and was in close contact with, because it may just be that we would just quarantine those students that were within that 6 foot, less than that 6 foot radius of that student, and not the entire class.
Correct. We also had a question in here. What is the number of confirmed COVID cases that would have to occur on a campus for a school to be shut down and switch to fully virtual learning? And there's not a set number in Crowley ISD or by the Tarrant County Public Health Department or by the TEA. That's a case-by-case basis, and working closely with those health officials to follow their guidance and to see what the spread has been like. And Missy, there's a difference between spread in the community and spread within the schools, right?
Absolutely, absolutely. And as of yet, we've had not any spread within our school district, even though we've had several cases throughout the summer, and even now, we do have positive cases that erupt from the community. You know, we had quite a few after Labor Day weekend. We saw that. We saw our numbers go up, just like Tarrant County seeing their numbers go up as well. So the whole point of our mitigation is to quarantine those positive cases and those close contacts around them, so that we don't have more positive cases.
Right. And we have a question here about asymptomatic students and staff. And what do we do about that? If are they spreading the virus and we don't know because they're not showing any symptoms?
And that could be a possibility, but that's why we wear the mask. That's what, to echo what Dr. McFarland said earlier, the most important thing we can do is that we all do our part in wearing a mask. And that will help mitigate the risk for infection among those that are asymptomatic.
Perfect. All right, Dr. Kohler, we have a couple of questions in the chat about substitute teachers. I know we have a great partnership with ESS we're going into year 2 with that. And they're working to recruit additional subs to make sure we're ready. But let's talk about how we'll rely on our subs this year and what kind of training they'll be receiving.
So, well, the first thing we're doing is making sure they're trained in our safety procedures and protocols that we want for our employees and students to follow. So the face masks, the social distancing, the sanitization, they're getting all of that training. In addition, they're getting training into our virtual platforms and how, especially at the secondary level, you may have kids face-to-face and kids virtual at the same time. So if a teacher is out because they are sick, or they have a sick child, or they have jury duty, or any of those kinds of things that pull teachers out of classrooms, we have to be sure that the substitutes can navigate both virtual and in person. And then there was another question in there about if somebody had to quarantine, you know, would they have to get a sub? And the reality is, if a teacher's absent, once we go back face to face, they need to put the absence in so we can get a sub, because whether the teacher is teaching virtually or not, we're still going to have students in the classroom, and we'll need to be sure they're monitored. We'll have to have somebody in there making sure students come into class and log on, even if the teacher is teaching virtually. But yes, and I know you recently, I saw you put that push out on Facebook. ESS is continuing to recruit subs, but we have a pretty good number who are ready to get back to work, and eager to follow the things we need them to do and start working with us in our classrooms.
We have some great substitutes here in Crowley ISD, and we'll continue to rely on them, and they're doing great things with our students. Something we talked about in our elementary session that's come up now, the dividers or protectors for the classroom. We've talked about the plexiglass shields and the cafeteria tables, but Mr. Reeves is the team working to get what we're calling these portable dividers into classrooms. Mr. Reeves, can you tell us more about those?
Yes, sir. So we have delivered 2 sets. First set we delivered to each campus for the staff, for any staff member that would be working with the community, for them to be able to have one. And then we also delivered an additional 100 to each campus for the principal to use at their discretion.
Right. Thank you, sir. There's a question in here about some parents have been asking if athletics, band, dance, and other electives are mandatory for face-to-face classes at the middle school level. So Dr. McFarland, I think this is about when we start offering in-person classes. If I'm in one of those electives, do I have to come in person, or can I continue to do that from home?
Yes, and so I believe that Mr. Keith can probably answer that question. I think we've kind of made some statements about that, and also I know Lincoln and Swan may be on the phone to deal with the others.
Absolutely. So when we published our virtual learning course catalog, we signified whether each course was available 100% online, whether it was hybrid, or whether it was only available in person. And so I think the question may be around those courses that are marked as hybrid, which would require students to come up to the campus periodically. And when it comes to a hybrid course, the instructor of the course and that campus leadership really works on how much, what does it really mean to be hybrid? So that will be communicated by the instructor of the hybrid courses early on in the virtual learning process about when students would need to come up to school and how frequently.
All right. Also, Mr. Swan, I know we had some conversations earlier about what was available hybrid and also face-to-face. You want to add anything to that, Mr. Swan?
Yes, sir. Thank you, Dr. McFarland. We're trying to actually also take care of some issues over there at Crowley High School, getting prepared for our game this coming Friday night. But I would like for everyone to just realize that it is important to realize that when it's hybrid, remember, it's just as it says. It's actually in the hands of the instructor. We know that the kids are going to need to have that flexibility. If a student actually has to go out for an intersessional type of situation where there's concerns with COVID or the increased cases of that, we know that those kids will still need to return back in a situation where they can't participate. We don't necessarily want to take anything away from the students. We want to make sure that every kid has the possibility and probability to participate no matter where they are. So we definitely want kids to continue to participate.
Gotcha.
Nurse Misty, I'm sure we discussed this in our elementary session. Apologies if we didn't touch on it here, but just 2 questions in there about teachers getting face masks and or face shields from Coach Morris. And yes, those will be provided. I know you even had some samples there to hold up, that one and then the face shield.
Yes. So every student and every teacher will be provided with a face mask and a face shield.
Great. Thank you. Thank you. And then a question here, are we going to be handing out more PPE just to I guess, to replenish supplies as we need, both for the face masks, the cleaning supplies, and things like that need to be stocked back up?
Absolutely. So we will, you'll let your campus nurse know, and a few days prior to you, your supplies getting low. It'll, of course, this first week or so, it'll be kind of a trial, and we'll see how much we go through, but those will be restocked and replenished.
Great. We had a question in here asking about how our principals collaborate. We have a phenomenal team of campus leaders, Dr. McFarland, that just do great work. And the collaboration that we see between campuses is really, really great. Even today from our visits, we could tell principals have been working together, sharing ideas and strategies for how to implement some of these new protocols. And so, yes, our principals are communicating and sharing their ideas and what works and what doesn't. So they do that on their own, and then we bring them together at times just to share those ideas. So they're phenomenal.
Right, and we have what's called what we call our principal leadership clusters, and so normally it's about 3 or 4 campuses that are working together. Now at the secondary level, of course, that would be all the all the middle schools working together in a cluster, and then the 9th grade campuses working together in a cluster, as well as the high school. So we meet in clusters. So yes, they do share information, and that's one of the reasons why we are actually doing physical walkthroughs for all of the campuses, is so that we can see best practices and identify those and share across the board, so that all campuses in the district will have the benefit of that collective knowledge.
Great. Well, we're over on our time, or we're wrapping up on our questions on the chat. But Dr. McFarland, I do know we need to acknowledge that there is fear and there's uncertainty out there among us as leaders, among our teachers, among our parents, among our students, our entire community. Well, I guess just as an opportunity to share some closing thoughts about how we move forward in times of fear and uncertainty, and knowing it's our job to do what's best for kids in our community, and how serious we take that.
I think the main thing is that we ask for everybody to understand that we're making decisions in an uncertain, unknown environment, and we're making those decisions based off the most reliable information that we have at that point in time. And so we're going to do that, and then we just need that. We ask for grace, and also that you remain flexible, that you remain agile, and realize that the one thing that will be constant in this scenario, in this situation, is change. So recognizing that this year will be filled with change, and that it will directly impact you, it'll directly impact me, it'll impact all of us. And so just being mindful of that, and know that we're going to be making the best decisions we possibly can. I can tell you that there are no decisions that we're making without studying the science, having strong collaboration with the board, and hearing from you all and hearing from our students and parents as well. And so what we do is we're going to make the best decision with the information we have, and do what we can to mitigate any possible negative outcomes. We can't guarantee that we will have no negative outcomes. I think if anybody could do that and say they could do that, then that's probably not being truthful with you. We acknowledge that a lot of this we don't know. What we do know is that we will have cases. What we know is that we've had cases, and that we have adopted protocols that have allowed us to have cases to address the area where exposures occurred, but also continue to have folks involved and engaged. And so that's one thing that Ms. Van Kampen with her team has done for us over the summer, is so we have figured out how to have kids come up and work out together in groups, and practice football and volleyball, and be in close proximity and close contact, and mitigate the spread. So we know it can be done because we're doing it. And so we'll continue to do it. Again, we just ask for patience, and that you understand that we are making the best decision that we can with the information we have. And we appreciate you. We know it's hard, but we'll get through this together.
All right. Well, Dr. McFarland, we thank you. Thank you, the administrators, but especially our teachers who stayed on to ask questions and just talk through this with us. Continue to send those questions in. Watch for updates. We had a question come in just now, Dr. McFarland. If there is a delay, when will be told? And once again, those dates we were looking at were next week. That's the week of September 28th.
Right.
We'll get another update from Tarrant County Public Health, and then I think the goal would be by October 1st or 2nd at the latest, knowing what October 5th is going to look like. You called it a game time decision.
Right, no doubt. That's what it'll be. So we ask you to simply stay tuned. Again, Fort Worth is going to make a decision tonight. That's going to be that will be information for us. But regardless of what they decide to do, we're going to do what's best for our district based on the information we have, as close to game time as possible. And so that will be next Thursday.
Right.
All right.
All right. Well, everyone, y'all have a great evening. Get some rest. Enjoy time with your families and at home. And we look forward to seeing you online tomorrow, virtually teaching, and we'll see you at campuses during our pandemic response team visits. Thanks
All
so
right.
much.
Thank you all very much. Have a good one.